good morning to everyone who is joining us on TVW right now. We are just waiting for Dr. Shah to troubleshoot some tech with his camera, and then we will get started. So thank you for your patience. Dr. Shah, can you hear us? There we go. We can see you now. And with that, let's get started. Good morning, everyone, and welcome to the December 21st COVID-19 media briefing. I'm Julie Grauert. I'll be your facilitator for the event. I would like to welcome our panel for today. Many of you've had the pleasure of just watching us for the last few minutes. We have Dr. Umair Shah, our Secretary of Health, Dr. Tao Kwan-Get, our Chief Science Officer, Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases, and Sheehan Allen, our COVID-19 Vaccine Director for the Washington State Department of Health. To begin today's briefing, we will open with remarks from Dr. Shah, who we would also like to thank for his last year of service, as today is his one-year anniversary with the Department of Health. Dr. Shah?
Thanks, Julie. Can you hear me okay?
Yes, I can hear and see you. Great.
Well, apologies, everybody. I've been having a little bit of technical issue with, as you saw, with my camera for the last few minutes. So a year into this, still having tech issues. So I think that has not changed. So I think maybe that theme continues throughout. But I want to, first of all, just thank you, Julie, for the 1 year shout out. And it has been an incredible journey this 1 year. So much. That all of us have to be proud of when it comes to our efforts against this pandemic and in really raising the visibility of public health and the partners and the work that they are doing on the ground every single day. So I just want to start by saying thank you to everyone for what you have all meant to us as we continue to move forward in fighting this pandemic, a pandemic that continues and has more twists and turns than freeways and roads that all of us have traversed over our lifetime. So this is another reminder that we may be tired of this virus, but this virus is not tired of us. I want to thank our media partners for your attendance today. I know a lot of you have been concerned about what's happening related to Omicron and what's happening in our state, and we're going to try to break that down for you as best we can. There is a lot of really good information related to not necessarily Omicron in particular, because there remains concerning news related to Omicron globally and as well across the country and in our state. But I do think it's important for us to be thinking about very much what are the tools that we have in our toolbox. So when I look back and think back a year ago, the vaccines had just arrived in the state of Washington, and many of the tools that we had were simply just wearing masks and trying to avoid others. And now we have vaccines. We have not just vaccines for adults, we have vaccines for 5 years of age and up. And we also have the promise and the benefit of boosters. And one of our key messages today is going to be about boosters. Whether it's Delta surge that we have in our state currently, whether it's Omicron that we're starting to see take hold in our state as well. The key is that there are things that all of us can do. One is to get vaccinated, and the other is to get our booster. And then the other is to make sure that we're following safety protocols and just thinking through how we can live safely and be careful around others. I think that is the key message for us today. So why don't we go ahead and get started? As CDC announced yesterday, the Omicron variant is now the prominent variant in the United States. We are watching this very closely. Obviously, the concern is all the unfolding information related to what is the transmissibility of Omicron, what's the severity of Omicron, how effective are vaccines against Omicron, and a lot of information that remains still to be told or to be gotten. And what we are doing is to process all that information globally and nationally, and also looking at what's happening here statewide. Statewide, we are not seeing the Omicron prevalence take over Delta yet, but Dr. Lindquist is going to talk about that in context so everybody recognizes the importance of what we are seeing with Omicron in our state. However, we have to remember that as we continue to look at what's happening across the state, our early surveillance from a lab standpoint was very much related to detecting Omicron in our state and then having a better view of where it was in our state. And that means that we also have to now shift to doing more representative sampling across the entire state so we can get a better picture of how and where it is spreading. What's important now is not just the numbers, but also very important is the severity of illness related to Omicron. Obviously, we are very concerned about outbreaks that we have been working with our partners on in wrestling tournaments, especially across the state of Washington. And we want to do everything we can to continue to keep our healthcare system strong and protected, as well as keeping hospitalizations down. Our healthcare system is absolutely stretched and strained right now. Many of our providers are being pushed in ways that they have never been pushed in their entirety of their careers. And that means that it has been really challenging whether you go to the largest of large hospitals or healthcare system or clinics in the state of Washington, or you go to the smallest of small. It's a similar theme that the staffing and the real challenges for staffing has been a significant concern for all of us. And we're doing everything we can as a state to be able to support our healthcare system. We are concerned that with Delta surge, that hospitalizations have started to and have continued to come down, but our concern is to watch what's happening with Omicron. By and large, thus far, the information is such that it appears that hospitalizations are not as much related to Omicron, but I want to caution everybody that it is too early to pronounce that as a done deal. Omicron, when it's got increased transmissibility compared to the Delta variant, the concern is that some proportion of those individuals are going to be hospitalized, and our concern is that our system is already strained, and what will happen if hospitalizations spike again or increase to a level, especially at a time of staffing constraints. That's a real challenge and a real concern for all of us. Julie, if you could pull that slide back up, I do want to focus on the importance of vaccinations. This is a message that we have said for months on months. In fact, I would dare say we've said now for at least a year that vaccinations work. They're safe, they're effective, and this shows you that hospitalization rates in the state of Washington in November very much track with those who are vaccinated are less likely, markedly less likely to be hospitalized in all age categories compared to those who are unvaccinated. And so we want to make sure that people recognize that while we're hearing news about Omicron, you're seeing what's happening in the hospital system, and you're saying, well, what can I do? Well, we know what you can do is first and foremost is to get vaccinated if you have not gotten vaccinated. But the key measure is that and if we could show the next slide for vaccines. Next slide. The numbers for the vaccines. So as of just a couple of days ago, we have administered more than 11.5 million doses of COVID vaccine across the state of Washington. And that means 5.5 million people. And what I want to make sure people recognize here is that that is amazing. That's one of the top states when it comes to vaccinations across the country. However, it is so critical now that people get boosters. A good portion of the people who are in the categories that's right on the slide here, the 11.5 million plus doses that have been administered, the 5.5 million plus people who have been vaccinated, we are going to ask you to come back if you're eligible and get vaccinated yet again. What that means is get your booster immediately if you are over the age of 16 and eligible, meaning 6 months past your Moderna or Pfizer vaccine or 2 months past your J&J vaccine. And also children over 5 should start their 2-dose vaccine series immediately. Why is this so critical? It is critical because of what we just showed, that vaccines work, they're safe, they're effective, but we also know that we have waning immunity, that over time those vaccines will need to get boosted. And the evidence is clear that we need to get this additional booster shot. We want to do everything we can to emphasize that message. Please get your booster immediately, as quickly as you can. Now, that said, we also recognize that it's in many places across the state of Washington challenging and difficult to get your boosters. Those appointments are hard to come by. So a few things for the public. First and foremost, if you're holding multiple vaccine appointments, please cancel them, especially if you know that you are now going to go to a certain site and you're going to get your booster. Please cancel your other appointments. Number 2, do not wait for the perfect booster. If you can get Moderna or Pfizer, the best booster is the one that's being offered to you. So do not try to get the perfect booster, Moderna or Pfizer, whichever booster vaccine is being offered at the clinic that you are going to or the site that you are going to, please get that booster. However, we're also very concerned about vaccine appointment availability. The governor has directed us at Department of Health to work with our partners to look at vaccine capacity as well as take aggressive steps to increase that capacity across the system. We are doing just that in terms of our planning and our work behind the scenes, and there will be an additional information that's going to come out over the next few days. But what the key message is that the governor and his team and our team are working together, and he has directed us to improve the vaccine appointment process in terms of availability of those appointments for people. And we are committed to getting boosters to Washingtonians across Washington. So in other words, when we say get your booster and then you try to go online or you try to make a phone call and you can't get your booster, you're frustrated. We know that. And we're doing everything we can to alleviate that and improve that system. We also recognize that there has been an increase in demand for boosters, especially around the holidays and people gathering, and especially as people are traveling. That said, that's a good thing. We want to see an increase in people excited about and interested in getting boosters. And that's something we're going to continue to support. That's the message. We want to continue to support that message and also take those actions to be able to increase that capacity. If I could show that other slide now of what else we can do as we get into the holidays and the winter time. This is a really important point of information. I hope that our media partners will be able to show this. It is not new information necessarily, but it is absolutely critical that we all take the steps that we can to protect ourselves. That means getting vaccinated first and foremost. And what that means is if you have not started your vaccine, please start your vaccine as quickly as you can. And if you have already gotten vaccinated, please get your booster shot, as I mentioned over the last few minutes. Wear your mask, watch your distance, wash your hands, be careful in crowds, be careful indoors. There are some very important messages. These are what we call safety protocols. These are how do you take and empower yourself with the ability to do things so that you can be safe and protected. There's so much we don't know about Omicron, but there's so much we absolutely know about Delta, which is all of these very simple but important actions are what are going to help all of us as we move forward in this holiday season. And we especially want you to be careful and utilize these actions as you are considering traveling, or if you're about to travel, to make sure that you're also aware what's happening in the destination that you're going into, whether across the US or whether it's in a global setting. The last message here is stay home. If you are sick, get tested, and we are doing everything we can. We're very appreciative of the president's announcement today about the importance of and the ability of the federal government to be able to get at-home testing for all Americans or most Americans or Americans who are interested in getting the tests at home. We think this is an important strategy that is absolutely key for people to be able to protect themselves and their loved ones, not just during the holidays, but beyond. And so, again, one of the biggest issues that we have is just the manufacturing capability for the at-home tests are just not there yet. So we're really hopeful with the president's announcement that we're going to start to see an increase in at-home testing availability, that capacity across the country, and also here in the state of Washington. A reminder to everybody is that if you feel that you are concerned, as we all are, about what's happening from it's getting you down, it's getting you depressed, you're anxious. We want to make sure that you're also taking time to take a breather from all the news that's out there, doing your best to take a break from those things, that you're getting good sleep, that you're taking your vitamins, that you're doing everything you can to be healthy, both physically and from a mental health standpoint. And if that means a spiritual standpoint, a behavioral health standpoint, or as I mentioned, a physical health standpoint, please focus on those things as well. And we want to do everything we can to be supportive. And we have additional information you can get on our DOH website. We also have our 833 VaxHelp for appointments. There's also information about mental and behavioral health resources. But the holidays are a very difficult time for everybody, the stress and the strain. But this year it's particularly concerning because all of us thought, and we're hopeful that by this December, we weren't going to have a new variant or we weren't going to have an increase in concern or cases. And that is not the case. And so we've got to do everything we can to support each other. So check on a neighbor, check on a family member, help them get a vaccine appointment, help them to a booster appointment, drive them over there, do something to help someone, a neighbor, a friend, someone who you don't even know, help them through this difficult time, and we will get through this together. So I'm excited about completing the 1 year. Today is that 1 year. I'm also very excited about what's coming in the year to come. And I am very much mindful that we've got some challenging times ahead of us. Get boosted. We're going to do everything we can as a state to be able to help you get your booster shot. It's going to also be really critical that people continue to take the actions that they can take to help protect themselves. And that includes all the things that we talked about. So with that, thank you so much. I'm going to now turn it over to Dr. Lindquist, who's going to talk about the data, the information related to Omicron, and also what we're seeing across with cases and hospitalizations in the state of Washington. Scott.
Okay, thank you. And appreciate that first year, Dr. Shaw. Thank you. It was a very hard time to come in and take over an agency during a pandemic, but thank you for sticking in there, and we're all behind you. So I want to talk about the case counts first. So if we could have the first slides here. So we all know this. We know we're in this fifth wave. It's coming down, and we're seeing some bumps in it. So I don't think we are out of the woods yet on this fifth wave, as we are introduced with two things that I'm very concerned about. One, the Omicron variant is becoming more and more the prevalent variant, and we'll talk a bit more about this in a sec. And I am just being alerted by our surveillance staff that we are starting to see the first cases of influenza A in the state. And so this is going to be a really unfortunate season where we have a new variant, Omicron, and we have flu appearing in the community at the same time, while our case counts are still pretty high. Our hospital systems are stretched. So let's go on to the next slide. This actually shows hospitalization counts. They are as high as some of the other previous still. It's not all entirely due to COVID. There is some over boarding in hospitals right now due to a typical winter rush. This again sets the stage for a very difficult winter where we're going to have flu now appearing, a new variant appearing, and hospital capacity is going to be limited. Especially during the holiday season, while we have an exhausted workforce that has been doing COVID hospitalizations for 2 years now almost. So next slide. And this really looks at case counts versus the hospitalization counts. It really makes the point that these follow almost verbatim. What tends to lag is death counts. And I'm happy to say that our death counts remain fairly low. What we had today reported were 34 deaths, and that is compared to almost doubling of that previously during this large fifth wave. So again, and you heard Dr. Shaw say it's way too early to predict, will Omicron cause excess hospitalization, excess death? This is really the point of what the state should be doing. We need to have a good, solid surveillance system, watching our case counts as Omicron becomes more and more prevalent, watching our hospitalization effect as Omicron becomes more and more prevalent and flu is here, and then watching our deaths to see. We're getting preliminary data, nothing that I feel comfortable predicting on yet, that this Omicron variant is not associated with as much death, hospitalization, or severe disease, but that remains to be seen as we watch this surveillance in Washington state. Now, having said that, Omicron is clearly here. As Dr. Shaw said, our main goal was to really look hard to see, was it even present in the state? And so we did very aggressive, very skewed sampling to see if we could find it. And we indeed have found it. Our Omicron cases that have been reported to me this morning are 400. 400 are associated with the Omicron of all the genotyping that we have done. Now, we're a very aggressive genotyping state, so that's not surprising the number is high. And so as Dr. Shaw said, we are now shifting the gears. It's not just about counting Omicron cases. It's about sampling the entire state. That's Eastern Washington, Western Washington, North, South, rural, urban, to see what is the prevalence of Omicron versus Delta and how fast does that unfold. So that is what we are really unfolding. I am incredibly comfortable with that infrastructure. We are one of the leading states for doing this genotyping, but that allows for some confusing messages that are coming out. We are hearing on the very leading edge, so high-risk patients, high-risk counties for Omicron, are seeing upwards of 70% of their samples are coming back as Omicron. That does not represent the state. And it does not represent anything other than really the leading edge of this infection. We still have quite a bit of Delta in the state, and our surveillance system is really picking up everywhere in Washington as a representative sample. So we will have better idea of how fast Omicron is unfolding. It appears to be very quick, as we are seeing globally, and our surveillance system is now starting to pick that up too. Leading edge, though, it's very different than representing the entire state. And with that, I just want to leave you with the fact that we are indeed seeing a preliminary increase in cases in those 14 to 19 for a very specific reason. We are having a very large outbreak in wrestling-associated tournaments where both students, refs, coaches, and people that attended these events are being diagnosed with COVID. And we know that Omicron is one of the variants that is in these. And as of this morning, we have over 350 cases associated with wrestling. This is going to be a very large outbreak. And again, I will end with this, reminding you all the things that Dr. Shaw told us about, really being smart about going to events like this, wearing a mask, making sure you've optimized your vaccination with a booster, with even getting vaccinated, and be very careful about being in these crowded spaces. These are what are going to bring on these outbreaks of Omicron in the state, as we're seeing with wrestling. So with that, I turn it back to you, Julie.
Thank you, Dr. Lindquist. We go now to Sheann. Go ahead.
Excellent. Good morning. I'm Sheann Allen. I'm the COVID vaccine director for the Department of Health. Our friend Michelle Roberts has taken some time off for the holidays. So first, I wanted to start by updating you on our vaccine numbers. And if we could pull up the slide, please. There we go. More than 82% of people 12 and older have received at least one dose. And you can see more than 75% of that age group have completed their primary vaccination series. Across the state, we've given out more than 11.6 million doses of vaccine over the past year to more than 5.5 million people. Let's keep that energy going and get even more of our friends, family, and community members vaccinated, boosted, and protected from the worst outcomes of this disease as we head into the new year. So speaking of boosters, as Dr. Shah said, we recommend everyone 16 and older get a booster shot as soon as they are eligible, which is 6 months after completing the Pfizer and Moderna primary vaccination series, or 2 months after getting the single shot of Johnson & Johnson or J&J vaccine. We know COVID-19 vaccination is effective at preventing severe disease, hospitalization, and death, but effectiveness does decrease over time, which is normal for vaccines. The recent emergence of Omicron variant further emphasizes the importance of vaccination and boosters. Both Moderna and Pfizer recently released information for preliminary lab studies, which found that their booster dose likely offers protection against Omicron strains. We expect more information to be shared from the manufacturers. So far, nearly 1.7 million people across Washington have received an additional dose, which is a combination of boosters and third dose. So there's much more work to do regarding boosters. Also, in the recent news, Pfizer shared new information on the ultra-low COVID-19 vaccine for even younger kids. Although the company says the vaccine appears safe for 2 to 4-year-olds, early studies show the 3 microgram shot may not provide enough protection. So Pfizer is now seeking approval for a third dose for that young age group. As of right now, we don't have a timeline for the next steps, but we'll share information out as it becomes available. But there is good news. More and more kids 5 to 11 are getting their Pfizer pediatric vaccine each day. More than 172 kids have received at least one dose, which is 25% of this younger age group. Last but not least, I want to talk about the updated vaccination recommendations that Department of Health released on Friday. Following guidance from the CDC's Advisory Committee on Immunization Practices and the Western State Scientific Safety Review Work Group, DOH is recommending people 18 and older choose to receive either Pfizer or Moderna over the J&J vaccine. The update comes from new data about TTS, which is a rare but serious condition involving blood clots and low blood platelet counts seen in people who receive J&J. Across Washington, about 436,000 doses of Johnson & Johnson, or J&J, have been given out, which is about 4% of the total doses administered across our state. J&J will still be an option for those who are not able to receive an mRNA vaccine. If people have any questions or concerns, we ask them to talk with their trusted healthcare provider about their options. With new variants like Omicron, vaccination, both primary series and booster, are more important than ever for everyone 5 and older. To find locations near you, visit the state vaccine locator website or vaccines.gov. And if you have questions or need help, please call the state's COVID-19 hotline at 833-VAX-HELP. Again, like Dr. Lindquist mentioned, this time of year, it's not just COVID-19 as the only illness that's circulating, it's also flu season. Remember, you can get your COVID-19 vaccine on the same day as you get your other vaccines, like your annual flu shot. We recommend a flu shot for everyone 6 months and older. Thank you, and I hope 2022 brings lots of happiness for all.
Thank you, Sheehan. And our final panelist is Dr. Kwanget. Go ahead.
Thank you, Julie. I just wanted to reinforce some of the messages that have already been given around childhood vaccination and hospital capacity. So it's so important that we continue to get as many children age 5 and older vaccinated against COVID-19 as soon as possible. As we know, COVID-19 in children can be a serious and sometimes fatal disease. In our state, over 1,000 children have been hospitalized and more than a dozen have lost their lives to COVID-19. And children with chronic conditions are especially at risk for severe disease. So we really need to get kids started on vaccination and current on vaccination for children also means getting boosters for those who are eligible. And so we're fortunate that now teenagers 16 years and older are eligible for a booster vaccine, which can powerfully increase their protection against the Omicron variant. It's also important to remember that vaccinating children not only protects them, it also helps protect the most vulnerable in our community. Vaccinating children can be an important way of protecting their grandparents, their aunts, their uncles, their parents, even siblings, other members of their family who are at higher risk of hospitalization and death from COVID-19, either because of age or chronic conditions. And that's really one of our most important goals, decreasing hospitalization and death from COVID-19. And to do that, all of us have a part to play. The more people we can keep out of the hospital, the more people we can keep alive. Our hospitals are highly stressed, not only because of COVID-19, but also because workforce shortages throughout the healthcare system are making it difficult for them to discharge patients without COVID-19 from the hospital. Even those patients who are well enough to get discharged to other facilities, such as long-term care facilities, are in the hospital because there's nowhere for them to get discharged. And when our hospitals get stressed, it's not only people admitted for COVID-19 at risk, it's all people requiring hospital care for any reason who are at risk. And this comes at a dangerous time because even before the pandemic, we saw seasonal surges in hospitalization from influenza and other respiratory viruses. And even before the advent of Omicron, our modeling projections were warning of the potential that our hospitals could be in for a very difficult winter. And now with a highly transmissible variant like Omicron, we are very, very concerned about hospital capacity. So all of us need to do everything we can do to keep people out of the hospital. And the most important thing is to get vaccinated and to get boosted. So thanks, and back to you, Julie.
Thank you so much, Dr. Kwanget. Since we started a little bit late, we will be going over 11 a.m. till 11:15 at least. We have 7 reporters in the queue right now, and we will begin with Ariel from the Spokesman Review. Go ahead.
Great, thank you. I have 2 questions this morning. First, looking at other countries and preliminary data coming out about Omicron, do you expect Omicron to lead to more hospitalizations in Eastern Washington and less vaccinated parts of the state? And then secondly, do you agree with the idea that some physicians have talked to me about that everyone is going to get COVID eventually? And if so, can you discuss why vaccination is still important?
Thanks, Ariel, and happy holidays to you. A couple of things, and obviously, both Dr. Kwanget and Dr. Lindquist can add to this. I would say a couple of things. One is that there are 2 ways that we can get protection from COVID. One is a more predictable, broader, effective, and longer lasting, which is vaccines. The other is to wait to get infected. Waiting to get infected is not a smart strategy. Why is it not a smart strategy? Well, it's because when you and your immune system is naive and has not had any protection from COVID-19, you have a significant risk of having severe illness. Now, it doesn't mean everybody's going to have severe illness, but the risk is higher, significantly higher. Where vaccines come in is it gives you a broader, longer protection, but it also, and this is a key issue, especially as we think about Omicron, is that it protects you from more severe illness. And that is where we are very concerned. So when you are hearing around the globe, people saying, well, Omicron, mild illness, mild symptoms, to us at Department of Health, it's too early to say that. Why? Because even if you have a significant number of people that get infected with a more easily transmissible variant like Omicron, and maybe not as severe, you still are going to get a proportion of those people who are going to have serious illness. Vaccinations, and especially boosters, because 5.5 million people have gotten vaccinated. So we know that people have gotten vaccinated, but that vaccine protection will eventually wane. It's gonna start to be less protective. It still protects you against severe illness, but it's less protective over time. And the reason that we are really pushing the message around boosters is to make sure people recognize that we know that those who are vaccinated, even with this Omicron variant, it appears those individuals are less likely to have severe illness. So it may be a confusing message to people, but it's pretty clear. Get boosted. Get boosted. Don't wait. Get boosted. And the reason is because we have a Delta surge already here, and now we're starting to see Omicron already take hold in our state. So we've got a lot of things we can really bank on. We've got it, right? It's in our back pocket. It's masks, and it's, being smart about how we go about our business, but it's also to get boosted. And that message is clear that it's about not just this current surge, but also concern around Omicron. Scott or Tao or Scott, you guys want to add anything to that?
No, I think you handled it well. And Ariel, my goal is not to get infected. Okay, so I'm doing everything I can to minimize my risk of getting infected. I am not thinking that's a good strategy.
I think the only thing I would add is that our data show that people who are unvaccinated are more than 10 times likely to be hospitalized and die of COVID-19 than people who are vaccinated. So getting vaccinated, getting boosted is going to help keep you out of the hospital and help keep you alive.
Thank you. Our next question comes from Nicole from Cairo Radio. Go ahead.
Good morning and happy holidays to you. With this shortage in at-home tests, until President Biden's announcement takes effect in the new year, what are you doing in the meantime so that more people can get these tests, especially those of us heading home for the holidays who want to test before that and make sure that we're being safe for our families? And if a person tests positive with an at-home test, how do they report that? Is that a problem that people aren't being honest and reporting positive results?
Yeah, thanks, Nicole, and also happy holidays to you. A couple of things that I would say is that we've already been doing what we can to help support the at-home test capacity or capabilities across the state. But it's been tough, when you don't have the supply. And, this goes back to what happened previously with vaccines, what happened previously with masks, what happened previously with any of the scarce resources. It becomes really challenging for us to be able to devise a robust strategy when the supply is just not there. So one of the things that we've been doing is really focusing on, well, with the supply that we have, where can we leverage it for the most effectiveness? And that includes in schools, that includes in certain settings, for example, federally qualified health centers or other clinics, where we really believe strongly that there is an importance to being able to get the tests out. Now, that said, we don't have enough of them to go around. And so every time we are in the midst of making a strategy that's going to be markedly more robust, the biggest hurdle that we have is the supply on the manufacturing side is just not there. So today's announcement from the president is absolutely critical to what all of us, not just in this state, but across the nation, are really wanting to see happen, which is to be able to empower people to be able to make good decisions as they go about their activities. Yes, get vaccinated. Yes, get boosted. But if you have been exposed or if you're not quite feeling well, we want you to be able to get tested. And so what is happening is there is not as much capacity on the at-home testing. It is putting a strain then on those partners on the ground that are including our support of those partners that are having, whether it's a drive-through or whether it's at a clinic, the testing that's more PCR testing that folks are doing. So it's becoming more challenging, but it's not one of those things where we have a significant amount of solution until we have the supply or the manufacturing capacity improved across the country so it's more available. Now, that said, I know the governor is very interested in this issue. And in fact, he and his team are working with the White House. They've made contact about the importance of this. We're having a very similar conversation with our health colleagues at the federal level to just remind them of the importance of testing at home, testing strategy, and the importance of getting that capability and that capacity improved in the state of Washington. So in the meantime, we are supporting everything we can for those local health departments and other partners who will have testing efforts that are not necessarily at home, but they're certainly important for their communities.
Our next question comes from.
Oh, I'm sorry, Scott, did you or Tal, did you want to answer the question about what happens when somebody tests positive or what they should do with an at-home test? What's that next step? Happy to jump in, but I think you guys can chime in here.
Yeah, no, the theme of today that you've heard said a couple of times is empowering individuals to make choices. And that is part of being empowered as an individual, is being empowered with the requirement to report you're positive. And clearly, at minimum, no, you need to isolate yourself for 10 days and identify any contacts that were close contacts. So yes, I think reporting this is important. There is a mechanism through dialing 211, which is the information line where you can report you're positive and it comes into the public health system. At minimum, you could call your provider and let them know, which I think is a good idea. Especially if you have underlying conditions, to report, hey, I just did a home test, it's positive, a discussion between you and your provider. I'm getting quite a bit of these calls from patients that I see in clinic. I advise them about the 10-day isolation and identifying the public health system. So there are mechanisms for doing this. But yes, indeed, I do not think our surveillance system is going to pick up every single positive and every single negative. And we need to adjust our surveillance system as this becomes more and more likely that people are empowered to do their own testing. By the way, being empowered to do your own testing also brings with it the reality of the shortage of test kits. That's empowering individuals to understand this is not a slam dunk that you go to any Walmart or any place and pick these up. It is going to take some work to get these at-home tests. We are going to help with that, and the federal government, as you heard, is going to help with that.
All right, our next question comes from Tom from Public Radio Olympia. Go ahead.
Hi, thank you, and happy holidays. Two-part question, perhaps for Dr. Shah, but maybe for the others, about delayed care. I'm wondering, with a new variant bearing down on us, to what extent you're concerned about a new round of people avoiding doctor's visits or maybe forced postponements of medical care. And related to that, to what extent could prior delayed care or hospital avoidance account for a large number of excess deaths in Washington residents this year from causes other than COVID?
Yeah, Tom, happy holidays. And this is a really important question. So thanks for asking. You got two additional docs on here, so I'm going to see if they have any additional perspectives. What I would say the most important thing is that we do not want people to delay care. And the reality is, though, people will likely be thinking about their care needs in a different way. Anytime you have a variant or some other news that comes out, people start to ask the question, do I want to go into the healthcare system right now? Do I want to wait? Do I want to wait? How important is this? How urgent is this? And I think the key message from all of us is we are talking to our healthcare partners across the system is that if you need, if it's an urgent, emergent issue, do not delay that care. Absolutely seek that care. But if you're not sure if it's urgent or emergent or an emergency, ask. Contact your healthcare provider. So while you may decide you may not go in person, you may decide you're not going to go to that clinic or that hospital, at least make contact with that clinic or hospital or your trusted healthcare provider. One, because they're going to likely remind you to get your vaccine, and let's hope they do that and make sure they remind you to get your booster. But they may also have a different way of looking at your specific condition. They may say, you know what, it doesn't look like it's that urgent and you can wait a little bit of time. Or they may say, you know what, we actually do believe you need to come in, and here's how we're going to help you be seen safely. Our healthcare system is safe, but people are making decisions when they should be making decisions in concert with their healthcare provider. And we want to make sure that that link with the patient and the provider is close, and it's on an ongoing basis. And where we can do things virtually and it's safe to do so, absolutely. But where it requires in-person, we want to make sure that people are making contact with their healthcare provider to make those decisions. So Scott, Tao, anything that I may have missed?
No, I really do. Tom, this happened last week to me. One of my patients with an underlying condition came into the clinic. We communicated, and I said, look, you really need to go in the hospital. Admitted this person to the hospital, but it took a heck of a lot of communication with the patient and the family, with the hospital. And I got to call out Seattle Children's Hospital. They did an absolutely fantastic job bringing in this patient who was, hesitant to come in because of this Omicron. And Children's has good protocols in place. It's all about communication. I'm talking to this family daily. They trust me. I give them this advice on what to do. So it's super critical that patients with underlying conditions or things that they're thinking about delaying communicate with their provider so that appropriate things can happen, and it's still available in the state, even in this case where I had to hospitalize this patient. Tao, any other thoughts from your standpoint?
No, I don't have anything to add. I think that's excellent advice. Yeah, to talk to your healthcare provider and also explore options such as virtual care that maybe might be safer than going in person. But I think the whole issue of the impact of delayed care from the pandemic is an incredibly important one, but also a very difficult one to quantify, and something that we'll need to look at the data long and hard to really assess.
Thank you. Our next question comes from Keith from Como. Go ahead.
Hi, and again, happy holidays. If you can help me out with the booster and the importance of it, and I'm all fully boosted. You were talking about 1.7 million people getting the booster or a third shot. Is that out of a total of 5.5 million that you were talking about with the first dose? And if that's the case, don't you have an incredibly small amount of people who need to get that third shot? And shouldn't that be considered fully vaccinated rather than just the 2 shots? And if you could answer that question. And also, given the fact that you've got the wrestling tournaments and the holidays coming up, are you considering asking the governor to encourage people to cut back on events, whether it's family gatherings, wrestling tournaments, sporting events, and any kind of further crackdown on the economy?
Yeah, thanks, Keith. Happy holidays. I'm going to ask Shan to jump in on that. Actually, you had I think 3 questions in the midst of that first question, so I'm going to keep you honest there, Keith. But on that, let me go with the second one, and then I'll turn it back to Shan on the booster question. When it comes to gatherings and activities, I think the other message that we're also reminding community members is the empowerment, right? Is the ability for you to make smart decisions, good decisions based on your risk and based on the risk that you have. Now, obviously, if you're vaccinated, you're boosted, you're wearing masks, and they're checking vaccine at the door, vaccine verification at the door. There's a additional spectrum of activities that are happening to keep people safe in that venue or that activity. Yeah, I mean, that's how you live safely with COVID, is you do your best. Now, does that mean that some people might decide, you know what, that's not enough, and I don't want to go to this activity? Absolutely, there are going to be people that do that all the time. I've made that same decision in our own family. So the key message is that we know, all of us, what to do to protect ourselves. And we also recognize that key component is to make sure that we are doing those very things. And so when you are talking about wrestling tournaments and we say, okay, well, maybe we should do X, Y, or Z related to those wrestling tournaments. I think the first and foremost thing is that when there are safety rules already in place, wear your mask, wear them the whole time, wear them if you're in the stands, if you're not actually in the physical activity of wrestling, wear them on the sidelines. And if you're not doing those things, you are now putting yourself and others at risk. So there are some really important things that all of us should be doing and can be doing as we are moving forward with our decisions on any particular activity. So, again, we continue to look at this not just on a daily basis, sometimes on an hourly basis, what's happening across the country, what's happening in Canada, what's happening globally, what's happening with the science, with the evidence. And when we need to make a pivot or change our decisions or make a recommendation to the governor about something, we absolutely will. At the same time, we also know that those tools are already in place. We just need to make sure that people are really availing themselves of them. Shan, on the boosters.
Excellent. So boosters, our favorite topic. So yes, Keith, you are correct. We have vaccinated 5.5 million individuals with primary series, and about 1.7 million have received booster doses or additional doses. We know that not all of those individuals that have received their primary series are eligible yet. We're expecting actually about 1 million individuals for the month of January to become eligible. We knew that November through January would be the biggest surge or the biggest the months where our Washingtonians would become eligible for booster doses. And so we are, ramping up different strategies to make sure that we can, again, offer more access points, reminding people that they're eligible. So doing a reminder recall system, promoting booster messaging through our different partners, through newsletters, really just reminding everyone about the importance of it. But again, working with the healthcare systems, hospitals, primary care, our mobile teams, our caravan to, again, offer more access points. We know that that's one of the limitations right now. And so the Department of Health and our partners are really diving deeper to identify additional strategies to offer more booster availability across our state.
Thank you. Our next question comes from Hannah from Fox 13. Go ahead. Hannah, can you hear me?
Good morning. Can you hear me?
Yes, we can. Go
Yes.
ahead.
So if people cannot get the booster in time for Christmas due to the backup, Also, these COVID testing lines are insane as of today. What is your best advice if you were talking to your family members about, Christmas gatherings? Does that change at all in light of Omicron? And then the second question is, those at-home rapid tests are anecdotally not as reliable, giving out negative results when people are actually positive. So what does the data say on those at-home rapid tests? How truly reliable are they?
Thanks, Hannah, for those questions. I'll turn the last one over to either Tao or Scott. Let me start with the first one. Is that my advice to my own family is keep on with what we've been doing. We're vaccinated. All the adults in our family are boosted. All the kids, as you may have seen on social media, are now fully with their 2 shots of vaccines, and the 5 to 11-year-olds just got their second shot just a week and a half ago. The advice that we're taking as a family is, look, risk is there. Be really smart about that. And that includes with our kids. Now, obviously, they're home for the holidays now for since yesterday, since Friday, and but it's really important for them to recognize that we're still in the midst of the pandemic. It would be great for all of us to just raise their hands and say, "Okay, we're done." I'd love to say that. That would be the first thing I would love to be announcing today, as this pandemic is over, but it's not. And so, where you make a decision, whether it's to go out to eat or whether it's to go into a park, whether it's going to the movies, whether it's going to a sporting event, there are things you can do to reduce your risk. And it is up to us to do that. Now, if you have not gotten your vaccines and you have not gotten your boosters, obviously that's where we're going to always start. And if you have availability of testing, that's really important, especially if you've been exposed or you have, if you have symptoms. So I think it's important for people to recognize that that is the priority, or those who have been exposed to COVID-19, as well as those who have symptoms of COVID-19. And it's important for us to always do a primer on that and just remember what those symptoms are, and just keep track of that as well. And as Scott mentioned, now we have flu that's starting to circulate in the state of Washington as well. So get your flu shot. I mean, there are things that we can do to empower ourselves, but then it's also important for us to be thinking about when we go out, outdoors is better than indoors. Being in a gathering where there are less people is better than a gathering where there are more people. There are some very important risk appropriate safety protocols that all of us can take. And that's why we want to continue to emphasize people just make smart decisions, in addition to get your vaccines, your boosters, and then certainly the importance of masking. That cannot be minimized. I think a lot of people have forgotten or just want to forget the importance of masking, especially in indoor or crowded settings, is so important right now, especially as we're hearing this Omicron variant take hold across the country. We absolutely need to be thinking about this very carefully.
And I can answer the rapid antigen question pretty quickly. The bottom line on these is they've been well studied. The FDA has information on their sensitivity and specificity, but the quick answer is they're good, but they're not perfect. And we're not entirely clear how they work against Omicron. There is preliminary data saying for the most part they work. But I think it's like anything. They're good, not perfect. Use your common sense. If you do one of these tests and it's negative and you have symptoms, then you need to go talk to your provider, get a higher level of testing in that case. That's what my recommendations for the holiday would be. Thanks.
It is now 11:10. We have 5 reporters left in the queue, and we are going to do our best to accommodate all of them. Elise from the Seattle Times, you are next. Go ahead.
Hi, thank you so much. Happy holidays. I am wondering 2 things. Number one, if there's any other specifics that we could get about potential next steps for increasing that appointment capacity? Are we talking about new sites or greater time windows? Any other clarity we can get on that? And then number two, I'm wondering if contact tracing is still a point of prioritization for the state. I think the most recent report on contact tracing and case investigation noted that only about 60-ish% of people who had tested positive were being notified or being investigated or interviewed. So just wondering if there's any plans in place to try to bolster that a little bit as Omicron continues to surge.
Yeah, Elise, thanks for that, and happy holidays. And I'll turn that last one over to Tao and Scott. What I would say on the vaccine capacity piece is that we've been watching this, and Shan can vouch for this, for weeks to months. This has not been a today issue. We're constantly, consistently looking at what vaccine capacity is. Now, there are a few things that have occurred. Demand has increased, and obviously we've got plenty of supply, but it's just making sure that it gets to the right places. So I don't have anything specific to share. As I said, I don't want to get ahead of where we're going to be over the next couple of days, and our teams are working at the governor's direction to make sure that we are ready and able to execute as we always do. But the other thing that's really important is that we also recognize that there are certain areas geographically where there may be more of that demand, supply-demand mismatch, if you will. And so one of those areas is South King County. And so as you know, the mobile vaccine unit that FEMA supported, and then in addition to that mobile vaccine unit that we had in Thurston County over the last couple of days of last week, is now in South King County in the Federal Way area. And it's not just the FEMA mobile vaccine unit, but it's also the support that we've been giving alongside it with our caravan efforts and our mobile vaccine efforts that are alongside. So it's a complementary piece. So what I see is really an opportunity to really bolster that as a capability. One thing that you can do to help us is to make sure, again, a reminder, don't wait for the perfect vaccine. Moderna, Pfizer both work. Number two is making sure people understand when they're eligible for boosters, 6 months out from the 2-dose or 2 months out from J&J. And number three is don't hold multiple appointments. And if you've got your appointment ready, cancel the other 4 that you're holding. And hopefully you don't have 5 in the first place, but do that. That's going to help the system equilibrate. I do think we're going to get into a better place once we get past the holidays. But again, we're constantly looking at this and doing everything we can to be able to support in areas where we are seeing more of those constraints on the demand and the supply side.
Can I clarify your question? Were you asking about vaccine or monoclonal antibodies? I thought I heard you say NAB.
Sure. Sorry. Yeah, that was vaccines.
Scott, did you or Tal want to talk about contact tracing or case investigation, and maybe taking Elisa's question a little bit further, just in the age of concern around Omicron as well?
I certainly can take it. The quick answer is we prioritize case investigation, contact tracing, especially around certain events, high-risk events. So this is exactly where we pour our resources when we hear about a wrestling match or a basketball game where there's been an outbreak. So we still, while overall, we're going to reach less and less people. So a reminder to the public, when public health calls, you got to answer your phone. But we are prioritizing these high-risk, big spreader events, especially with Omicron. So that is where we are putting our resources right now. It's still a very valuable intervention.
And Julie, I know that how many reporters do you have in the queue? Because we want to make sure that that we give everybody opportunity. I know we're doing like 2 or 3 answers to every question. We'll try to go faster.
We have 4 reporters left in the queue. And our next one is Kelly from K2. Go ahead.
Perfect. Thank you so much for taking our questions today. I do also, I'm sorry, have two questions. The first one is, we are hearing down here, I cover the Southwest Washington area, just for your knowledge. We're hearing down here that some health officials are saying to prepare yourself again for the possibility of needing to stay home and having, supplies on standby. Of course, when we hear that, we get a little concerned that we're going to see that mass run for stockpiling. What would you say to people to not panic, but instead prepare? My second question is regarding hospitalizations, and I know that we're saying we're not sure at this point if Omicron is less severe, but even still, we are hearing a lot of health professionals like yourselves saying that hospitalizations are still a concern. Is that at the same level that we saw with Delta? Specifically meaning, are you expecting needing intubation, things like that? Or is it at a less severe level, maybe needing fluids and to get that dehydration out of them, that sort of thing? What are you expecting when it does come to Omicron hospitalizations?
Thanks, Kelly. I'll try to tackle both of these really quickly and see if Tower Scott or Sheehan have anything they want to add. On the first one is that my entire career has been about preparation, and whether it's COVID-19 or whether it's a winter storm or whether it's a power outage, there are many things that all of us need to be doing today to make sure that we are always prepared for the myriad of urgent issues that can come up. So I would just say, the general message is be prepared. But the other message is that we are watching what's happening with Omicron carefully. And that means that Omicron is absolutely increasing and it concerns us, but there are a few things that you can do. We've talked about all those, so I'm not going to go through those, but the key is to get boosted. And those who have not gotten vaccinated, that is a key message for us because we're really concerned about severity of illness. Now, Omicron, in the way that Tao and Scott and I have been talking about this, is that transmissibility means that you may have more numbers of people that get infected. And when you have more numbers of people that get infected, you have a proportion of those who are going to have severe illness. Now, whether that means they just need support, for example, as you said, IV fluids, and it's more of an inpatient quick in and out, or does that mean that it's going to require more ventilator support? These are unknowns. We don't have this information, and it would be great if we had this information, but that's what the experience that we need to get about Omicron is really all about. So great questions. We don't have all the answers, but we do always recommend to people, and really this is a time to do that, especially as we get into the winter, is to make sure that you continue to be prepared.
Our next question comes from Christine from King 5. Go ahead. Christine, can you hear us? I can see your name popping up as a speaker, but we are not getting audio. Let's move on to Graham Johnson, and Christine, I'll touch base with you in another chat. Graham, go ahead.
Hi, good morning. Dr. Shaw, given the president's announcement about at-home testing and the supply problem that you outlined, how long will it take before people see a noticeable difference in their availability? And were opportunities missed to make at-home tests more available sooner?
Graham, happy holidays. Thanks for that question. A couple of things. I'm not as interested in armchair quarterbacking, what could have, should have, would have, all those things. What I'm really interested in is what can we do now moving forward? And so this is not an easy area of work because at-home testing requires manufacturing. Manufacturing requires companies to be able to do certain things and to be able to do it in a mass. Now, there have been increases in the supply of at-home tests across the system. If I remember correctly, some of the numbers meant that there was going to be a 20% increase, is what the federal government had made mention of on a monthly basis. And so today's announcement significantly increases that. But what we really need to be mindful of is today is the announcement. We don't have all the specifics of what that looks like. And so it's too early to say how quickly we're going to see tangible increases in the capacity or the supplies to increase. Right now, that is an unknown. And we do believe over the next several days that we will start to get more specifics about that. Heck, it may be next week before we get the specifics on what that looks like. But right now, it's really very much about staying with the course of what we have and really being very interested and very focused on when the supply is available, or as the supply is available, that Washington is just in the mix for getting those at-home tests and not further behind any other states that are out there.
Thank you. We are going to try Christine again from King 5. Christine?
Hello, can you hear me okay?
Yes, we can. Thanks.
Okay, thanks so much. So in just a bit, President Biden is expected to make his announcement, and part of that is some FEMA assistance for hospitals ahead of potential surges from Omicron. We're talking nurses and healthcare personnel helping hospitals in various states. Is there any discussion on that yet, and what will that look like for Washington?
Thanks, Christina. Glad you could chime back in, and happy holidays. I will say that we've already gotten assistance from the federal government. So one is the FEMA mobile vaccine unit that was in Thurston, and now that's going to King County, starting King County yesterday. As well, we've been leveraging the federal contract. If you remember, a couple of months ago, we talked about the importance of thank you, the FEMA mobile vaccination unit, the MVU that was in Thurston last week, and so you can see some images there. Thank you to our media team for showing that. The other piece of this is really about what we've already been able to do with the leveraging of the federal contracts to be able to get additional staffing into the healthcare system, and very appreciative of that. Again, we don't have all the details of what this is going to look like when it comes to FEMA support for states like ours. We certainly know that every year we have very limited capacity because of flu season and respiratory viruses and everything else that happens in the winter months in the state of Washington. This is going to be my second go around, although the first one was quite a bit of a blur. But I will tell you that that is absolutely important for us to, one, get more details, but number two, to make sure, again, Washington, as we need support or where we need support, that we are also getting that appropriate support from our federal partners. And since they've continued to come through for us the last few months, we have no doubt that they will continue to listen to us and be able to help us. That includes, by the way, when we were saying we needed more pediatric vaccine, we needed more doses of vaccine, they did increase the doses delivered to the state of Washington. So we're very appreciative of that, but we want to continue to obviously make sure that they're aware of what our needs are, and so they can help us fill those. Now, whatever is happening at the federal level doesn't mean that we're not going to be doing things at the state level. We've already been working with our health sub-cabinet, healthcare authority, DSHS, and others to make sure everything that we can do to help support our healthcare system we're doing. And certainly that doesn't mean that we have solved this issue, because it is a very complicated issue. But the other challenge is just to make sure that everyone recognizes that we're working hand in hand with our partners at the state level so that we can help support what's happening even without the federal government involved in that process.
And our final question comes from Charlotte from GeekWire. Charlotte, go ahead.
Hi, I'm wondering if you have any suggestions for what our tech companies or other employers can do as we face a potential Omicron surge and increased flu this season.
Thanks, Charlotte. Happy holidays. What I would say to you is really what we've been saying to everybody, is the importance of championing the messages and where you can to encourage, incentivize, or require, depending on what the case may be, for your employees to get these life-saving vaccines. And I think that's a critical message. The the fact is that a lot of people are getting boosters. But the other fact is that a lot of people got confused at some point during the process of whether they should be getting a booster. And this is a real opportunity for businesses in the private sector to help us champion those messages of get vaccinated and also get boosted. The other thing is to make sure that your workplace policies are supportive of employees who may have to call in sick. If they have a reason not to come to work that's concerning from a respiratory standpoint, symptoms that are vague or not quite clear, to have a system set up that you can help them get tested or testing capability or capacity, but also that you encourage them not to expose others. We do not want to see outbreaks in our businesses and anywhere in the state of Washington, but certainly there are things that people can do, businesses can do to help people stay safe and sound and secure. The last thing I would say is be very mindful of the safety protocols that we have also highlighted about masks and the crowds and indoor, including where you can ventilation and improving your ability to really support the workplace and make sure that workplace is really safe for people to work there. So those are some few things. From the tech side, the last thing I would just put in there is that many companies obviously can, on the tech side, still work virtually, and where you can, obviously being supportive of teleworking or working virtually as much as possible. It's not always possible and not possible for all of your staff or employees, but that's also a critical piece of this as well.
Thank you. And Dr. Shah, would you like any concluding remarks?
Well, look, 1 year in, it's been a ride. It's been an incredible journey. And I can't say enough about our team, this team, and all the team members across the Department of Health for what an amazing dedicated, passionate staff that we have, and all the partners that we have across the communities and everywhere who have just done so much to help protect Washingtonians. And then most of all, I want to say thank you to Washingtonians for just everything that you have done to help protect yourselves, your families, your people around you, your communities. But I think the key message is that this pandemic is far from over, and Omicron is the latest reminder of that. And there are some very, very basic things that you can do to empower yourselves, your families, and all those around you to help protect them. Get vaccinated, get boosted, get boosted. Such a key message. Get vaccinated, get boosted, and then remember to really recognize your risk and what you can do to help mitigate your risk, including getting tested, including staying away from others when you're sick, including being very careful around gatherings, very careful around travel. And ultimately, we are going to get through this difficult winter. But when we get through this difficult winter, we're going to see the sun come back out in the Pacific Northwest, and it's going to be a bright future for us. But we have some difficult challenges ahead of us. So with that, I want to say thank you again. And Julie, I'll turn it back to you to close.
Thank you so much, Dr. Shah. We do want to remind everyone that if you need to report a positive test, a positive at-home test, you can call 833-VAX-HELP. And with that, that concludes today's media briefing. We appreciate your patience as we ran a little bit late. Hope you have a great holiday.